My name is Valerie Koster. I'm a nurse-midwife. I had my undergraduate nursing education at the University of Illinois in Chicago, and I did my graduate work at the University of Utah. Well, I got introduced to this because I adopted a child who I subsequently found out to have an FASD. In the 1970s, when I was in college for nursing, there was nothing said about alcohol related to pregnancies. Then in the 80s, mid-80s, I went to my midwifery program and we talked about fetal alcohol syndrome. And then I adopted my child in 2004, and the mom had been drinking during the pregnancy and doing drugs. And I thought, this does not sound good, but several people, looked at her picture and they're like, well, she doesn't have FAS. And she doesn't have FAS, but I did not know at that time about fetal alcohol spectrum disorders, that there's other disorders that are invisible. When she was in about 5th grade, the CDC and SAMHSA were actually doing centers for excellence around the country to try to make awareness of FASDs to professionals, to healthcare professionals. So I ended up doing a week-long course to become a trainer for SAMHSA in this endeavor. And after doing that, of course, I bring it into my courses for new nurses. I'd like to have midwives and doctors be good at not only doing the screening and brief interventions, but also documenting if women have had if they've had any alcohol exposure in the pregnancy, because that documentation can make a difference as to whether kids could get services, a diagnosis and services in the future. And services are really critical.